it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's TIPisode, mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America.
My name is Rafael Rondon, and I am the VP of Hygiene Operations for Coast Dental. Throughout the years, I've had the opportunity to work in different settings. In my beginning stages of being a hygienist, I started working in a hospital, that was a great opportunity to learn different things in that setting. Then after that, I moved on to working with a periodontist, which gave me a deeper level of understanding of periodontal disease. And then the rest of the years, I've been working with general practice, which again, you get to see different processes and protocols and guidelines depending on the doctor and the practice you're working in. However, one of the things that I learned through the years is learning to create your own process and protocols when you're seeing your patients. It's very important to do that because it creates consistency with your patients as you're seeing them. Yes, the diagnosis may be different for every patient you're seeing. However, the process is the same for each patient to ensure you're gathering all information needed to give your patient the best treatment based on their needs. Of course, your guidelines and protocols that you're creating should be completely aligned with the Academy of Periodontology and the ADA, which helps us be able to be more accurate and at least have things that are focused on evidence-based, things that really we know can help our patients based on studies and evidence. As preventive specialists, we should always think first as a hygienist is to ensure that we're looking at the most common diseases that we're trying to prevent, which is caries and periodontal disease. That's the reason I put in place throughout the years 3 steps that I do for every single patient, which is first, assessing the patients with a caries risk, 2, creating a perio assessment for my patient, as well as doing an oral cancer screening, which this helps you determine the risk level this patient may be in for caries or periodontal disease. This will help you as a clinician to be proactive rather than reactive. I also learned that it's very important to include and involve your patient in the process by simply asking them questions such as, have you ever had an assessment performed to determine your risk for cavities or gum disease? And then just wait and see what the patient has to say. That will start creating an urgency to know exactly what that means and what exactly is going to happen at this visit. As you continue to assess your patients, you want to inform them the process of what you're doing. If you're going to be probing them in a sense of taking measurements, you want to make sure that you're letting them know what the numbers mean. And by calling those numbers out loud, it creates urgency and value to what you're going to explain to them based on their needs. As we get deeper into a caries assessment, you may have a patient that's been coming to you for the past 10 years. This person has been coming in regularly every 6 months, good oral hygiene, everything has been great. No cavities, pockets been just 1 to 2 millimeters, 3 millimeters, no bleeding, great patient. However, this time this patient comes in and says that they're suffering from high blood pressure and they're taking a medication for it. At that point and at that time, our responsibility as a preventive specialist is be proactive. That means they've never had caries, never had decay. However, our job is to start preventing and educate the patient on placing fluoride and perhaps sealants. Because at this time, this patient is considered to be high risk because the medication may cause dry mouth. And as you may know, there's 700 medications out there that may cause dry mouth. So it's very important for us to do an assessment that includes the patient, as I said before. So the ADA has a great form on their website that you could utilize to create that process of doing a caries risk assessment. In this form, you'll see questions as, have you ever had cavities in the last 3 years? And how many snacks do you have between meals? This form has other questions that will help you determine the risk level when it comes to your patient. The ADA guidelines also indicate that a patient can be low risk, moderate risk, and high risk. In fact, there is 3 codes that indicate the risk level for each patient that you are able to even send to the insurance to help that patient get some benefits if possible. For low risk, the code is 0601 For moderate risk is a 0602, and for high risk is a 0603. These codes are created to send to the insurance, again, to see if there's any benefits for them. So by performing a carriers risk assessment on your patient, you were able to determine the continuing care needed based on the risk. For example, a low-risk patient could continue coming in every 6 months. However, a high-risk patient, according to the ADA, could be coming in every 3 to 6 months for continuing care. Something to always keep in mind as you continue to assess your patient is all the risk factors that the ADA has indicated that can place that patient at risk for decay. I remember one time that I was coaching a hygienist on talking to her in reference to fluoride and the benefit of talking to our patients about it. And I had a moment that she asked me to help her take some numbers as she was probing. And I went to the operatory to help her out, and I was writing the numbers as she was probing. And she indicated 6 to 7 areas of recession. So at that point, she finished the probing, and I left the room, but I stayed close by. And through the whole appointment, I did not hear her talking to the patient about fluoride. So everything was done, the patient left, and I started speaking to her in the end. And I asked her, why didn't she speak to the patient about fluoride? And she stated, oh no, she has very good oral hygiene. She comes every 6 months. Is a very good patient. She takes care of herself. And I said, okay, great, that's good. And then I asked her, didn't you tell me that she had 6 to 7 areas of recession? And she said, yes, she did. I said, well, based on the carriers risk factors from the ADA, puts that patient at risk. In fact, moderate risk for getting decay. Not only that, we went into her medical history and we saw that she suffers from high blood pressure. And I went to see if she was taking medication for it. And yes, she was. Now, for moderate risk, this patient is a high risk patient because of dry mouth. So therefore, one of the things is to ensure that as a provider, as a clinician, that we're looking at the whole picture, not just seeing one area and saying, great, she's good, she has good oral hygiene, and we don't need to talk to that patient about fluoride. Just keep in mind that there's many other factors that could have this patient at risk for getting decay. In fact, the ADA has a great list of factors such as, again, poor oral hygiene. It could be prolonged nursing. Again, the list goes on and on. So it's our job to just not determine just by having one area that is good to forget about the others as a provider. Another piece that you could add to your protocol in gathering information and assessing your patient is to add a saliva test so it could determine the pH of that patient. In fact, GC America has a great tool that you could utilize for that process. It actually brings some strips. It brings a saliva pH indicator that I believe it really creates value for that service for the patient to see and understand the why they're going to be getting fluoride or sealants in that visit. For more information, you can go to the GC America website for more information. In conclusion, as a preventive specialist, it's our job to ensure we gather information and assess our patients to ensure we give them the best treatment necessary and giving them the best standard of care. So assess your patients when it comes to performing a oral cancer screening, a peri-assessment, and a carriers risk assessment, and also including process or tools that will help you create more value for the service, such as the GC America saliva testing for pH. Again, we are providers and we're here to provide our patients with the best standard of care. Thank you.
A tale of two hygienists.